Okay. So when you said depression has gone on all your life, can you give me about an age where you remember?
7, 8 years old.
Okay. Okay. Well, it sounds to me like I pretty much know what you're dealing with. You said you're feeling signs of depression. Sometimes when you're over depressed, you sleep. When you are awake, you feel pain or you cry. So you take painkillers or you drink just so that you don't think about it anymore. I know that you do have history of depression. Do you have history of substance use?
Well,
Or
I drink alcohol, but
in your younger ages?
yeah,
You said
since
you.
I was like 16, 17.
Okay. Okay. So what I recommend right now is that we do a couple assessments. The assessments are not going to be based off who you are, okay, and what you've become. It's just basically an idea of a level of depression you might be facing, or some type of risk that you might be facing because of the depression and the use of substances. Do you think that would be something you'd be interested
Yeah,
in
sure.
doing? Okay. So the first one, it's going to be about substance use. It's going to be a questionnaire. It's going to be a total of 20 questions, and this one's very simple. You just answer yes or no. Then when you're done, I'll let you know the results on that one. The second one is going to be a questionnaire about depression. So you're going to answer on a level of not at all to nearly every day that you're facing these. And this one's very quick. It's 9 questions. And then when you're done again, I'll go ahead and total up your score, and then I'll let you know where you fall on the.
Okay.
Okay, so just let me know when you're done, and then we'll go ahead and explain what the results mean. And just keep in mind, this is not based off who you are. It's just kind of a scenario of what you might be facing or what might come if the behavior that you don't like just keeps going and going. So,
Okay.
okay.
So I guess I'm done.
Okay. All right. So let me just look through this very quickly, and we'll go ahead and see the scores that you got, okay? Okay. So on the depression, you fall under the very difficult score. Very difficult meaning you're facing difficult times for your depression. You fell out of 20, and the severe depression is rated the total score from 20 to 27. This is not saying that you're in a severe depression, but you might be at risk at being in a severe depression if you keep maybe taking pain relievers to heal the pain and things like that. Okay, so what I'm gonna do is I'm gonna recommend probably some counseling and a program for support where you don't feel so much alone. And I'll get you those referrals in a little bit. And then you can come back to me after you've taken or attended a couple of support groups and let me know how it's making you feel from now till then, okay?
Okay.
Alrighty. Well, thank you for coming in. I look forward to seeing you.
Thank you.
Yes, ma'am. Have a great day.
You too.